experienced student.
Mm-hmm. So you think that experienced nurses are more confident in their judgment?
More what?
More confident?
More confident? Oh, I think they're more confident in that they're not nervous to be around patients. They're not nervous to talk to patients. They have more confidence in those areas of interacting with patients. So I think that's a big hurdle that novice nurses need to get over to be able to appropriately treat them. So once they get over that hurdle and they're more comfortable and confident in their surroundings and their environment, then I think a lot of those factors go away.
Mm-hmm. But it's not really about the judgment piece then. It's more about the interaction with patients, is it?
In my opinion, yes.
Okay. And do you feel that there is a difference judgment-wise?
Honestly, not across the board. I think that there can be, definitely. I think that there are some nurses that have been practicing, that have been developing their clinical judgment. But I think overall that the roles are different enough that the nurse at the bedside isn't necessarily at a much greater advantage than the novice nursing student in terms of clinical judgment.
Mm-hmm. So do you think that direct entry students have some challenges that are particular to their program or population?
Yes, I think they have a lot of challenges that, a lot of things they perceive as challenges are actually assets. I think a lot of times they come in saying, I don't know about healthcare, I don't know anything about this, but what they don't realize is that what they bring to the table can be very impactful. So, patients or students who, I had a student who her background was in music, and she was a concert pianist, and she said, I have nothing to do with this. And so she was able to bring some of those assets forward and was able to really connect with patients on a very different level than some of her classmates, understanding how to center herself, and she had a lot of qualities that other nurses didn't have. So I think sometimes their challenges are not truly challenges, but there are definitely some challenges that they come in with in terms of, I think that because I think healthcare is a whole new world and a new language and a new everything that they're exposed to. So I think that they need to come in understanding they don't have experience in this area yet. So I think they need to, even though that they're usually a little bit older of a student and have life experience, they need to be ready and open to the fact that they're going to be a completely new novice, and sometimes that's hard for them to drop their egos at the door and be able to understand that they're brand new at this and they have to learn.
Are you talking about nurses or direct entry now?
Oh, direct entry.
Okay.
Sorry, were we talking about the other one?
No, I just want to make sure I was following you. So you're saying that direct entry are coming into the program and they have to readjust their ego in terms of having to start from scratch in this new role, right?
Yeah.
Okay.
Yeah. They need to be ready to. They're a novice in this, and that can be difficult for some, which I don't find as much with my students that are either nurses before or that have had experience in healthcare. They understand what they're going into, I guess, a little more. So that can be a challenge. Let me think what else. I think a lot of times work-life balance is a big challenge for this group in particular, because oftentimes they already have established families, or they're not the traditional college student who's in and this holds true, I guess, for both areas. So I guess it's not just the direct entry nurses, it's both nurses going back to school or direct entry, but they're not usually traditional college students where they have 100% of their focus is on their coursework, so that can be a little tricky. Let me think, direct entry in particular. I guess direct entry in particular, that they, again, it's a whole nother language they need to learn. I remember I was talking to one about recording I's and O's, and she thought that I was meaning I's like EYE, and she didn't understand how it had to do with it. So I was like, no, ins and outs. So it's all little abbreviations that we use regularly, and it's a whole new world of language. So it was that definitely is once in a while catches me off guard. I'm like, oh, that's right, they know nothing. So it's really they have to play a lot of catch up to get prepared for what they will see in their clinical settings.
Mm-hmm. And we spoke about challenges, but you also mentioned assets. Do you think they have assets at direct entry in this program?
I'm sorry, what?
Do you think they have assets coming into the...
I definitely think they have assets. I think they have way more assets than they give themselves credit for. I think that the life experience they can bring and the different perspective and different knowledge that they bring to the table is huge. And I think that they're able to question the systems in ways that we can't question it, that we're used to doing it because we do it that way. So, you know, I constantly talk to my students about never stop asking why and giving them examples of ways that medicine has always been doing something for a certain way because no one ever asked why, and it actually isn't the best way to do it. So having those life experiences and having the confidence in some instances to stand up or to ask questions is something that comes with age and experience, and that's something they can bring to the table that they certainly want to look at. The other piece, I think, is that they can bring their own backgrounds to the table as well, which oftentimes are a huge asset, no matter what it is. I mean, I've had, like I said, I had a concert pianist. I've had students that have backgrounds in finance and backgrounds in quality control and backgrounds in construction work. I mean, it's so many different pieces, but they bring so much to the table in terms of an architect that was questioning why floors were laid out the way they were laid out. And I was like, well, I don't know the why. So it was, you know, it's great. They can bring all those pieces and add that to their nursing. Because I tell my students all the time, it's whatever you love to do plus nursing, and you can find your niche with them. That it's, you know, any piece, there's so many different areas to go into. So I think they bring a huge wealth of information and experience to our field.
Mm-hmm. Anything else in terms of assets?
Let me think. I think that covers it. Pretty much the life experience is the biggest thing. I think they bring in a different perspective or fresh perspective.
Mm-hmm. And it's a lot about seeing things in a different way than nurses do, right? Or healthcare workers.
Yes. Yeah.
And what about traditional students? What are their challenges?
Traditional students, I think their challenges are similar in that they are not able. They usually have a life outside of just school, so they're not doing just school. They're not the traditional undergraduate student that can just focus 100% on their course load. So I think that's a challenge, just to be able to work with them to make sure that they are able to get the reading done, and we're giving them reasonable assignments and course load for that. So that's definitely a challenge, I think, there. I think that sometimes leaving their sacred cows at the door, so there's reasons, again, like this is the opposite, where we do things the way we do things, that's the way we do it, and being able to drop those kind of preconceived notions about the way things should be done when evidence may show us a different way. So being able to kind of have that communication of, you know, that this may be the way you taught it, and, you know, the mid-'80s, but this is not the way we're doing it now. So we need to talk about why we changed it. And this is, you know, so they bring in their own experience as a nurse, but sometimes it's not always best practice the way they've been doing things. So trying to break bad habits sometimes can be a challenge for them and for the educators. I think that they also, again, this is preconceived things they bring into practice. I had another one. I'm trying to remember what it was. Let's see. No, that may probably the preconceived notions they bring in, not only with patient care, but also with, you know, the way that the hierarchy of the way things work in healthcare, and they already kind of have preconceived ideas of the ways that things are done. They may not question things as readily, or they may be kind of already accepting of the ways that we've align things in the healthcare world. So,
mm-hmm. And you said bad habits that they have to unlearn.
Yep.
Can you tell me a little bit about that?
So I think for example, you have the OR nurse who started. I mean, this isn't the case anymore, but you had the OR nurse who was starting in the OR in the late 70s, and she always would shave the patient before surgery and whatever spot they were having operated on. We don't do that anymore. So something like that, as a NP, they may need to unlearn that, like, that's not the way it's done. Or, you know, there's things that have changed in healthcare, and if they haven't kept up with their continuing education or organizations